Hi, I'm Dr. Mark Setter, and I've been a periodontist for a little over 30 years. And you're about to see some information on an extraction system that can change your practice. For many of us, extractions are scheduled at the end of the day when we're not sure how much time it's going to take to achieve an extraction. The system you're about to see we've been using for a number of years has made extractions a predictable procedure within a very short period of time. Once you get the technique, the extractions happen in a matter of minutes predictably with minimal damage to the bone. So I would invite you to listen closely. The information you're about to see can have a major impact on your practice.
When we're talking about dental implants, we're talking about removing non-restorable teeth. And removing teeth has always been a difficult thing for many practitioners. I've been using the Physics Forceps for quite a while now, and I find that it's just a magical piece of equipment. It allows me to easily remove very damaged teeth without damaging the bone surrounding those teeth. And that's very critical for implant placement and socket grafting. We want to maintain that buccal plate as much as possible. The Forceps is a wonderful tool that my patients have responded very positively to. I had a patient the other day who warned me before I was taking out a very damaged tooth that the last tooth she had taken out, the dentist literally put his knee on her chest to remove it. And so she expected a very difficult extraction. I was done in a matter of minutes using the Physics Forceps. And she was amazed. She literally teared up in the chair and gave me a big hug. She was so happy that it was an easy extraction. So it's an amazing instrument. I say it's magic. And I say that to my staff every time I use it. It's just magic. It's something that is so special. And I strongly recommend that if you don't have it in your armamentarium, that you do have it, because it'll make your life that much easier.
The Physics Forceps allows us to be effective and efficient. But most importantly, it allows us to maintain the buccal plate of bone. Not only do I do full mouth extractions in my practice, but I also place implants. And so it's essential to try and maintain that buccal plate when thinking of placing implants in the future. When implementing the Physics Forceps, the first step is to take the beak of the forceps and engage it into the lingual or palatal aspect of the tooth, such as this. Notice I don't want to squeeze when I do this type of motion. The next thing I'm going to do is take the bumper of the forceps and place it as apically as possible in the mucofold, or the vestibule fold. You're going to go ahead and make a lever motion such as this. And a lot of dentists have a tendency to want to squeeze. We don't want to squeeze, otherwise you will crack the buccal plate of bone. What you want to do is engage that tooth and then use a lever action and put some pressure on it. And what I found in my practice when I utilize this instrument is after about 20 seconds of putting force on this, the periodontal ligament is separated, and then all of a sudden the tooth will loosen up, and that's when we either A, will take a cotton forceps or take our fingers with gauze and pull the tooth out. It's as simple as that. One of the things that I found with the Physics Forceps, that it doesn't matter what size dentist implements it into their practice. Whether you're a muscular dentist or you're a small-sized dentist, or even if you're a male or female dentist, by using the levers, the biomechanics of this forceps allow you to take any tooth out without having to put so much force onto the tooth, or to have to put your knee into the patient's chest that we've heard so many times in our practice from existing patients. Some dentists may be overwhelmed from the cost at first glance, but when you look at the time that it's going to save you, the fact that it's an atraumatic extraction, I think you'll find that the Physics Forceps is definitely worth it. I've been using it now for almost a year, and I can tell you I highly recommend it to any dentist that I lecture to. We also teach it in our Reconstructive Dentistry Institute, and all the dentists that have implemented it have found that it works great.
First, open the instrument wide. Then, engage the beak deep on the lingual aspect of the root. Next, set the bumper at the mucogingival junction. Note the fixed position of the hand on the instrument. Do not squeeze the handles. Slowly apply pressure, rolling in an arc towards the buccal to accomplish an occlusal lift. Using wrist movement only, disengaging it from the socket. At the first sign of movement, or what is commonly referred to as the pop, stop. The instrument has performed its intended use. Now you can use an instrument of choice to grasp and remove the tooth from the socket.
So let's observe the periapical digital radiograph, and you can see the significant decay in the 3 teeth in question. They're broken down. Obviously, we discuss all the treatment options with the patient, and we elected to extract those teeth, and today we're going to put a removable transitional appliance in this position. What we're going to be doing today is extracting the maxillary right lateral incisor, maxillary right central incisor, and maxillary left central incisor due to excessive decay. We're going to be using the Physics Forceps to do this atraumatic extraction. But before we begin, we're going to anesthetize the area using 1 to 100,000 articaine. And simple infiltration is fine. The first thing we're going to do when we're using the Physics Forceps is to flatten the palatal surface of the root to give us a purchase point for the flat end of the Physics Forceps. Using the maxillary anterior Physics Forceps, we're going to establish our purchase point with our flat end using the bumper area on the buccal plate. And I'm not using a lot of force here, but I am kind of holding it with my finger so it doesn't slip off, and I'm simply rotating my wrist, and it just popped a little bit, and you can actually feel that little pop. And the tooth came out quite easily. Let's move on to our second one. Again, getting that bumper onto the facial as far down into the vestibule as you can. And again, simply rotating my wrist. And you can feel the pop. And we'll simply take a and you can see an easy extraction without damaging the facial plate. It's critical, especially during implant placement. And let's do the third one, and we are going to be all finished. Again, putting the bumper deep in the vestibule, establishing a purchase point on the lingual, and I'm using very little strength, rather just rotation. It popped. And again, leaving the facial plate completely intact. Simply going to squeeze the area of any excess of blood. Have the flipper, please. And we have a transitional appliance that we will place, close down, put your chin down, give the camera a nice smile. Best you can. There you go. We're all done.
Okay.
Okay.
That's a bumper which really acts as a fulcrum. An instrument.
There you go.
Okay, so we have a bumper. Okay, that acts as a fulcrum. We
Jill,
have a
take-
purchase instrument.
Jill, take a couple deep breaths for me, okay?
Jill,
Nice deep
take a
breaths.
couple deep breaths.
Sorry, Dr. Nash.
There's the purchase instrument right here that goes on the root, and then it converts the handles of the instrument into a lever. So the purchase is on the root, the bumper is at the facial. Basically, I can, and
Picture my patient.
you see I'm just holding this with just two fingers. Okay. And this handle then becomes a lever. And with the principle of a lever, that goes back to Archimedes, give me a lever, a place to spin, I can move the world. I can just hold this and then put a little slight pressure on it. And I'm not squeezing my fingers together, I'm just holding the fingers at the same position and rotating this as one unit to the buckle for about 2 degrees and just hold it there. And okay, let's see if we can rotate her head away a little bit. Okay, so I've had it here now for about a minute. And I'll rotate it another little bit. Again, just a rotation. And wait.
Yeah, that's better.
And you're waiting for the creep to settle in to the structure. And typically you'll feel the tooth release. You'll feel it in your handle of the instrument. You'll see the tooth move about 1 millimeter. And that's all we're trying to do. We're just trying to release the tooth with this instrument without fracturing anything. See, the tissue on the facial is a little bit blanched. You know? You see, you don't need much of a purchase point on the tooth. The tooth can be fractured like this one is, in which functional crown lengthening is not going to be great on this area because of the shape of the root and the length of the root. So we've elected to place an implant rather than removing 3 millimeters of bone and removing some tissue and then end up with a compromised root on it. So the goal is to take this out and place it with an implant. And since the first premolar is in the aesthetic zone, we'd like the implant to reside about 1.5 millimeters from the facial plate. Not in the center of the tooth, and certainly not where the apex of the tooth is. There, you see the release? Did you see that? Okay. And so all of a sudden the tooth released. You see that? Millimeter? And I felt it in the handle. That's all we're trying to do with this instrument. Just get that tooth to break that attachment. Now I can take really any instrument from this point. I'm taking a little root instrument and holding the root.
Hello, my name is John Suzuki. I'm professor of periodontology and oral implantology at Temple University in Philadelphia, Pennsylvania. We've started using the Physics Forceps for extractions, especially atraumatic extractions. In our graduate periodontology clinic, we find them to be invaluable at beginning the atraumatic extraction process.
Hi, I'm Dr. Helena Perez. I'm the chairman of the Department of Oral and Maxillofacial Surgery here at University of Detroit Mercy Dental School. The advantage of these instruments is because using a biomechanical advantage to take the teeth out rather than just your strength, it doesn't matter how strong you are. If the instrument is used properly, you get leverage, and difficult extractions can be done very efficiently.
You know, I think many times in offices, dentists schedule extractions if they're not comfortable with doing them at the end of the day, so they know when, if the extraction runs longer, that they're not going to have their schedule demolished for the rest of the day. One thing that using these forceps has allowed me to do is to be predictable in how much time it takes to do an extraction. Generally, if there's any coronal portion at all, meaning anything above the CEJ, we can get the extraction done in 2 or 3 minutes. And so, unlike other extraction techniques where you're concerned that you may not get the tooth out in the allocated time, I would suggest to you that the amount of time you'll need is going to be 1, less, and 2, predictably less than conventional extraction techniques, because this will deliver the tooth every time. And most often with no buccal bone damage, particularly if you're mindful of not trying to deliver the tooth completely with this forceps. So, extractions that used to take up to 20 minutes long because you were concerned about really being able to deliver the tooth, now are in terms of a few minutes. And so I would suggest to you, quite frankly, you can't afford not to use these forceps.
Hi, my name is Dr. Jennifer Silk, and I'm a periodontist practicing in Chicago, Illinois. I've been in private practice for about 8 years now, and I started using the Physics Forceps roughly 3 years ago, and I can say that it's honestly cut down on a lot of time that it takes me to take out teeth. In the past, a lot of times I would use a piezoelectric, I would have to section roots, I would take half an hour to get a tooth out. Now, the first time I used the Physics Forceps, I know that when I used it for a canine, it was out in a matter of minutes, and the patient couldn't believe that the tooth was actually out. So I can say that it's definitely been an asset to my practice and has turned out to be something that I use on a daily basis.
It's a very cost-effective treatment. It used to be more or less a loss leader for us. We used to tell patients that when they ask how long it takes for an extraction, they always say 5 minutes to an hour and a half. Because it was just very unpredictable and knowing exactly how much effort and time it's going to take. Now, we schedule no more than 20 minutes for any extraction because it doesn't take much time, and so we're not overbooked, we're not running behind, we're always on schedule, and we have happier patients. As a matter of fact, we have a lot of dentists now that used to refer to the oral surgeons for extractions who are now referring to us. So we're doing more and more extractions as a result of happier patients going back to their general dentists.
we're going to section this broken down root. Not a vibration. Stay open, someone's getting it? Open big for me, sir. There you go. Get it? Yes. I'm recording. Suction choke. We're not getting the sound. Big for me, sir. Good. Got it? Open real big for me, sir. It's a little bit hard. Open big. Stay like that. Open big.
So what we're going to do is use this elevator and push this up to make sure when the tooth comes out, the bone doesn't come with it. Because there's a big hunk of bone right here. We don't want that to come with it. Which can happen, so we're just going to have to push. You have to push all the way down. See? Come all the way down. I pushed about that far down. Okay?
I'm out of the way.
Now, I would normally hold this tooth here. You have that, Jay?
Yeah.
So, I want to go farther down. I'm going to take my little diamond and turn it on, push, and go down about 2 millimeters. All I'm doing is changing my angle to my favor. So when I take this tooth out, instead of being here now, I'm down about 3 millimeters. Less root, less leverage, less force. And all I'm doing now is just waiting for the energy to build up. Yeah. There it goes. You're done. Did you even know I did that? Did you know I did that?
Hi, I'm Dr. Ray Hayes. I'm a prosthodontist from Rochester, Indiana. I've been utilizing these forceps and trying them out for about 3 years. Pretty amazing. Something I'd like to share with you is my daughter's a dentist, graduated about 2 years ago, and she came through one of Dr. Mish's programs. We showed her how to utilize these, and she's called me up excited about taking teeth out now. She's looking forward to Monday mornings and extracting teeth, and she's had a lot better results with that. I've also used them in my study club, and most of my referring dentists now, I have them utilizing these. And I've got a lot better ridges whenever the soft tissue heals up. So doing a lot better job on the ridge preservation and maintaining the labial bone.
I've been teaching at the University of Detroit Mercy Dental School for over 2 years now, and I introduced the Physics Forceps to the students. I have had a great reaction from the students. The ones who want to try something different besides the conventional forceps have found them very easy to use. They like the fact that they can do the more difficult extractions instead of giving them to the residents, since no surgery is involved. So they've been taking them on their mission trips, and they've been taking them to the UHC, the hospital clinics, where we do so many extractions, and they find that they can do them simply and efficiently, and they're wanting to use them all the time now. They're their go-to instruments.
Well, we're going to take this elevator, which I always refer to because it's a wisdom tooth and a back molar, and I'm going to slowly push it up against the bone. So when I take this tooth out, the bone doesn't come with it. I'm up about that much. Now I'm going to take my little diamond and do a little drilling, so when I put my beak on, I'll have a little better purchase point. I'm going to use my third molar instrument because the regular instrument will never get back there. On the third molar, you put the bumper on first, then the beak. Oh, you just relax, okay? You just relax. Now, are you terrified?
No.
You trust me? I asked all the women that. You trust me?
I have no choice.
What?
I have no choice right now.
You have no choice, do you? Well, guess what? You're done. Told you it was a piece of cake. If you do A and B right, C has to follow.
Lay down. That's a wrap, people.
Hi, I'm Dr. Richard Golden. I'm here to introduce you to an instrument that I've been working on for about a year. It's an instrument that I've improved based on an existing instrument. This instrument's been around for about 100 years. It's called a 69, where all other instruments, forceps, will not work in the extraction or the final removal of any upper tooth, including root tips, because you can't grab the beak, or the tooth is so severely decayed that the instruments won't work. This instrument, the GMX69, can virtually take out any root tip, any upper tooth, if you understand, number one, the theory behind it and how to use it. We've designed this instrument to complement it with two elevators. The elevators were designed as duplicates of the beaks of the instrument. The buckle and the lingual. If you understand the use of the elevators, then the use of the instrument will follow. What we want to achieve here is to take the elevator, there's a lingual and a buccal elevator that is designed to go between the gum and the bone all the way to the end of the root. Between the gum and the bone, all the way to the end of the root. You have to be farther up with these elevators than the root. These instruments are designed to go all the way up to the end of the root. And what we want to do is take the lingual and the buccal, come back, take the forceps, replace it where the elevators were, wrist movement only. The instruments cannot work unless you use your wrist only. Never squeeze the instrument, and all you're doing is compressing the bone, and that tooth will come out. This instrument has been designed to be complemented by 2 elevators, as I've mentioned before. The instrument is sold as a set, and I guarantee you that any upper tooth that either the instruments you're used to using, this instrument can take out virtually any remainder of a tooth, root tip, or broken root or broken tooth, if you understand the theory behind it and the application of both elevators and the instrument. It is sold as a set, and I want to thank you very much for watching. Thank you.
For more information, please visit our website at www.physicsforceps.com or call 1-877-987-2284.